Hello, future doctors. How are you all? Welcome back to MedSteps YouTube channel by Dr. Anand. So, today we are going to learn one of the most commonly ordered investigation. If any patient coming to uh, hospital or OPD, that time we are going to do investigation of liver function test. So, easily we can tell LFT. So, interestingly, the name liver function test is a little misleading because not every test in the liver function test panel measures liver function. Some tests indicate liver cell injury, some indicates bile flow obstruction, and only if you truly assess how well the liver is functioning. So, by the end of this lecture, you will be able to understand every liver function test parameters and interpretation abnormal liver function test patterns and differentiate hepatocellular and cholecystic diseases and identify causes of jaundice and how to apply the liver function test to real clinical cases. So everything you can learn in this video. Okay, so without time waste, let's begin. If you are seeing here, this is the main liver function test. So the liver is the largest internal organ. You can see here, this is the largest internal organ and the largest gland in the over body. So it performs more than 500 vital functions every day. So think of the liver as the body's chemical factory. So it performs four major jobs. Like first one, metabolism. So the liver main thing, it will metabolize carbohydrates, proteins and fats. For example, it stores glucose as glycogen and it produces glucose during fasting, like through gluconeogenesis, and it produces cholesterol and metabolize amino acids. Without the liver, our body can't maintain normal blood sugar. Next one you can see here, that is detoxification. Every medicine you swallow eventually reaches the liver. The liver detoxifies alcohol, drugs, toxins, hormones, ammonia. So this is why liver failure causes drug accumulation and hepatic encephalopathy. Next, you can see that is bile production. This bile production, um, if you're seeing here in liver, the liver produces about 600 to 1000 ml of bile daily. So the bile helps to digest fats, absorb fat soluble vitamins A, D, E, K, and excrete bilirubin and cholesterol. If bile can't flow, patients develop jaundice and itching. Next, last one we can see, that is protein synthesis. So in protein synthesis, the liver produces albumin, clotting factors, and complement proteins and transport proteins. And if anything problem with the liver and failure of protein synthesis, it causes edema and prolonged bleeding. So these are things we can see. Okay. So now, what is liver function test? Liver function test is a group of blood tests that evaluates liver injury, bile duct obstruction, and protein synthesis and bilirubin metabolism. And it helps answer three important questions. Are liver cells are damaged? Is bile flowing normally or not? Is the liver functioning adequately happening in body or not? So these are things we can see in this liver function test. So next we can see here, that is indications. In indications you can see here. So when we have to must be order this liver function test means, if patient have jaundice and abdominal pain, nausea and vomiting, right upper quadrant pain, um, and dark urine, fatigue, anorexia, dark urine, pale stools, and pruritus, and monitoring known liver diseases before surgery and drug therapy and routine health checkup, and more amount of alcohol abused person and viral hepatitis. Okay, these are the main indications for investigating liver function test. So next you can see here, we have some basic functions reflected by liver function test. So here the basic functions will be, like you can see, first one, hepatocellular integrity. Hepatocellular integrity means It's we can find out easily the damage to hepatocytes and the leakage of enzymes. Next, bile formation and excretion. This bile formation and excretion, it's impairment of any patient have any obstruction or any impairment or patient have any cholestasis or elevated enzymes. So and bilirubin, then we can see that is liver function test. Next one, synthetic function. So in this synthetic function, we can see that reduced synthesis of proteins, albumin, and clotting factors. Next, metabolic and detoxification. So it's like impairment affects metabolism of bilirubin and drugs and hormone. Okay. Next, we can see here that is components of liver function test. So this liver function test can be divided into four different groups. One is group one. In group one, you can see here that is uh, markers of hepatocellular injury. That this tells us of cells are damaged and includes like ALT, AST, and LDH. Group 2 will be like we can see that is uh, markers of cholestasis. Like this cholestasis tells us whether the bile whether the bile is obstructed, includes like ALP, includes like ALP and GJT and 5 nucleotides. Next, you can see group 3, that is markers of liver synthetic function. So this markers of liver synthetic function, you can see here that is um, this main liver synthetic function will tells us whether the liver is still functioning or not. Includes like albumin and prothrombin and INR and total protein. Next, we have another group 4, that is markers of bilirubin metabolism. Includes like total bilirubin, direct bilirubin, and indirect bilirubin. So first we can see here that is markers of hepatocellular injury. This hepatocellular injury we can see here that is ALT. Okay. Yeah. You can see here that is first one ALT. ALT means also known as SGPT. ALT stands for alanine aminotransferase. It's found mainly inside the hepatocytes. Okay. So the normal value you can see here that is 7 to 56 units you can see, and when hepatocytes are damaged and ALT leaks into the bloodstream, and therefore the high ALT, it will indicates liver cell injury. That is the most specific. If any ALT increase means we have to suspect patient have specific for liver cell injury. So the main causes will be like viral hepatitis, fatty liver disease, and drug-induced liver injury, and autoimmune hepatitis. In clinical importance, ALT is more specific than AST. Okay. Next, we can see here that is AST. AST is found in liver, heart, skeletal muscle, and kidney and brain. So here, if high AST means does not always mean liver disease. So always interpret AST with ALT. The normal value you can see here that is 8 to 40. You can see here. Okay. So the AST we can call aspartate aminotransferase. So how we can check that ratio and everything means this AST and ALT ratio. This ratio, if less than 1 means usually viral hepatitis, fatty liver, and acute liver injury. If greater than 2 ratio means, while checking ratio, if greater than 2 means, then it's like strongly suggest alcoholic liver disease. Why? Because alcohol damages mitochondria and releasing mitochondrial AST, and alcohol also causes vitamin B6 deficiency, reducing ALT activity. So next we can see here that is ALP, means alkaline phosphatase. So this alkaline phosphatase is produced in um, bile ducts and bone, and you can see in placenta and intestine. So this normal value you can see here that is 44 to 147. If high alkaline phosphatase indicates cholestasis. Okay, cholestasis, and it causes gallstones, bile duct obstruction, and primary biliary cholangitis, and um, pancreatic cancer, compressing bile duct. And always remember, this alkaline phosphate is also elevated in bone disease. So next we can see here, that is GGT. In GGT we can tell that is gamma glutamyl transferase. So the normal will be, you can see, like 9 to 48, and this GGT confirms whether elevated alkaline phosphate originates from the liver. And in clinical scenario, if alkaline phosphate increased or GGT will increase, means the patient have liver disease. If only ALP increased, means GGT normal, means the patient have bone disease. Okay, so like that we have to differentiate the values. So the GGT is always elevated in chronic alcohol consumption patient. So next we can see here, that is LDH. LDH means it's like lactate dehydrogenase. It's like non-specific for severe hepatocellular damage. Okay. So next we can see here, that is very important things. In markers of cholecystitis, we can see ALP, GGT, and 5 nucleotidase. ALP always indicates bile duct obstruction and cholestasis, we discussed already. GGT will be like confirms hepatocellular origin and of raised alkaline phosphate. If 5 nucleotidase elevated, means we have to suspect patient have cholestasis, and it's raised in especially direct in obstructive jaundice. Next, we can see here some markers of you can see here some markers of synthetic function, like total proteins. In proteins, it's decreased in chronic liver disease. Okay, if patient have any ascites and everything. Okay, next you can see here albumin. Albumin is produced only by the liver. So in normal value of albumin, you can see that is 3.5 to 5 grams per deciliter. Okay, the albumin main function is it maintains oncotic pressure. The albumin means single test of synthetic function. Along with the main functions of albumin, we can see maintenance of oncotic pressure, and it carries drugs and carries hormones, maintains plasma volume. And low albumin causes, like patient have any low albumin will causes peripheral edema, ascites, poor wound healing. And always remember, albumin reflects chronic liver function because its half-life is about 20 days. So next we can see here, that is globulin. The globulin may be raised in chronic liver diseases. So next, AG albumin and globulin ratio reverts in chronic liver diseases. Next we can see, that is prothrombin time and INR. So this prothrombin time, the liver synthesis some clotting factors, like clotting factor 2, 5 and 7 and 9 and 10. So when the liver fails, the prothrombin becomes prolonged. This is one of the earliest sign of severe liver dysfunction. Unlike albumin, like patient changes rapidly because clotting factors have short half-life. Okay, so these are things, and prolonged in impaired synthesis of clotting factors. So these are the main um, liver function test and everything. So next you can see here, that is bilirubin. Bilirubin is very important thing, because with bilirubin we can diagnose many different things. Okay, different pathological conditions. So here we can see, to understand bilirubin, imagine the life cycle of your red blood cell. The red blood cell lives about 120 days. So the old red blood cells are destroyed in the spleen. Hemoglobin is broke down into heme and globin. So this heme becomes bilirubin, and initially it's conjugated bilirubin. If this heme becomes bilirubin, then we call that is direct or conjugated bilirubin, and it's raised in obstructive jaundice and hepatocellular jaundice. Okay, so and this other things main forms is like water soluble and bound to albumin, and the liver conjugates bilirubin using UDP glucuronide, glucuronide transferase. Now it becomes direct conjugated bilirubin. So this form is water soluble and excrete in bile. Okay, so next we can see that is causes of unconjugated indirect bilirubin. We can see like raised in hemolytic jaundice and pre-hepatic causes. So this causes of unconjugated hyperbilirubinemia means it's like it will cause hemolysis and Gilbert syndrome and Krigler-Nudger syndrome. Next, you can see causes of conjugated hyperbilirubinemia means that is direct bilirubin means like gallstones, hepatitis, and biliary obstruction and pancreatic carcinoma. Okay, so these are things main important things. Next, we can see here some liver function test patterns. So these are the main patterns. Whenever you are saying liver function test, instead of memorizing numbers, we have to look that pattern. If you understand this pattern, easily you can differentiate the pathological condition based on this pattern. So next we can see here that if first one we can see here that is hepatocellular injury. This hepatocellular injury, the alkaline um, the alanine transferase ALT increases more and AST compared with ALT increased more compared with AST. Then ALP will be like mild or moderate. Then if bilirubin and GGT will be like mild or increased moderate, then we have to suspect patient have viral hepatitis, drug-induced hepatitis or liver injury or autoimmune hepatitis, okay, or cirrhosis. So next another pattern if you are seeing here that is cholestatic obstruction. In cholestatic obstruction the ALP will increase and GJT will increase but like mildly it will raised. Okay, so this ALP will increase more. ALT and AST it will reduce less, but ALP is the main. Alkaline phosphate will increase more and GJT will increase but very mild and direct bilirubin will increase like moderate or direct. So then we have to suspect patient have some gallstones or carcinoma or biliary obstruction or head of pancreas cancer or primary biliary cholangitis or primary sclerosing cholangitis or biliary obstruction. So next you can see here that is mixed pattern. In mixed pattern, we can see the alkaline phosphate AST and ALT will everything will increase. Then it's that means the patient have like some alcoholic hepatitis and metastatic liver disease and steatohepatitis. Okay, so here whenever you are interpreting any liver function test, we have to focus on um, we have to follow some steps. In step 1, always look at ALT and AST. So is patient have any liver injury present? The ALT is more specific than AST for liver diseases. So next we have to check with ratio. Uh, ratio like AST and ALT we have to compare and we have to check ratio. If greater than 2 means against alcoholic liver disease. Next, we have to look at alkaline phosphate and GJT. If this alkaline phosphate and GJT both raised, then we have to suspect patient have cholestasis. Next, we can see here that is we have to look at bilirubin levels, conjugated or unconjugated. Conjugated means you can see here that is direct bilirubin. Unconjugated means indirect bilirubin. So in unconjugated bilirubin, increased means it's like patient have hemolysis and Gilbert syndrome. Okay, and then after we can look at albumin and prothrombin. Is liver synthetic function is impaired? Then we can see like worse prognosis and poor synthetic function based on that prolonged prothrombin and everything. We can find out. Next, we have to correlate with history like drug user or alcohol more amount of alcohol consumption or patient have any viral hepatitis or gallstones. We have to um, interpret it. Okay. Next, you can see here These are the main causes of abnormal liver function test. Okay, so now we can see here some cases at last. We have hepatocellular causes. If abnormal liver function test, we can see hepatocellular causes like viral hepatitis, alcohol liver disease, um, non-alcoholic fatty liver disease, and NEET, drug-induced liver disease, autoimmune hepatitis, and liver cirrhosis. In cholestatic, you can see like gallstones, bile duct structures, carcinoma and head of pancreas, primary biliary cholangitis, and primary sclerosing cholangitis. Pre-hepatic, whenever you are getting hepatic causes, we have to divide it into pre-hepatic and interhepatic and post-hepatic. In pre-hepatic, we can see like hemolytic anemia and ineffective erythropoiesis and hereditary hyperbilirubinemia. In others, we can see heart failure, sepsis, infiltrative liver diseases, and Wilson's disease and hemochromatosis. Next, we have to approach to abnormal liver function test, like identify the pattern, hepatocellular or cholestatic or mixed. And we have to evaluate severity, like mild, moderate, and severe. Next, we have to look for cause, history based on physical examination risk factors. Next, we have to do further investigation like ultrasound and viral markers and auto antibodies and iron studies, etc. Like we have to manage and we have to monitor that liver function test, and we have to treat the cause, and we have to monitor liver function test, and that is the main that's the main trends. Okay, so next we can see here that is liver function test are screening tools, not diagnostic by themselves. Okay, so these are the things. Whenever you are doing any liver function test interpretation, always we have to correlate with history. Okay, liver function test don't just give numbers, that tells the story. So that's why whenever you are seeing any um, liver function test for interpreting, always the ALT is more specific than AST for liver injury. This AST and ALT is greater than 2 means always suggest patient have alcohol liver disease. If ALP and GGT is elevated means it indicates cholestasis, and isolated ALP elevation with normal GGT, and it suggests bone diseases. Low albumin always indicates chronic liver disease dysfunction. Prolonged prothrombin is an early marker of severe liver failure. So the bilirubin alone can't distinguish the cause of jaundice. Always interpret it with ALT, AST, and ALP and GGT. So I will give one patient case. So based on this um, clinical case, you can comment me that answer in while listening this question. Okay. So one patient is there, the ALT will be like 850, AST will be like 620, ALP is normal, and what's your diagnosis? Next, we can second case will be like ALP is 650, GGT is high, and direct bilirubin is high, and the diagnosis will be, you have to tell me, you have to write in comment section. In case 3, the AST will be like 240, ALT 90, and AST is to ALT greater than 2, and tell me the diagnosis. So these are the main things. So remember, a liver function test is not just a collection of laboratory numbers. It tells the story of the liver. So think in 4 steps. Is there hepatocellular injury? Is there cholestasis? Is liver synthetic function preserved? What is the underlying clinical cause? When you interpret liver function test using the systemic approach, you will confidently diagnose conditions such as viral hepatitis, alcoholic liver disease, fatty liver disease, and obstructive jaundice, liver cirrhosis, and acute liver failure. So that's all. We covered almost everything in this liver function test interpretation. So if you didn't subscribe my channel, if these videos are helping you, please like, share, and subscribe my channel. And if you have any doubt, you can ask me in comment section, and you can follow me in Instagram and Telegram. If you have any concerns, you can say through these platforms. Okay, so we will meet in our next